Episode 52, The Paradox.
Welcome to The Paradox with your attending Dr. Eric Larson. He is a practicing anesthesiologist and clinical assistant professor at Michigan State University College of Human Medicine. Listen in as he takes you behind the scenes of what practicing medicine in today's ever-changing world is like with another doctor. The Paradox is a fun and accidentally informative show for physicians, patients, or anyone who has ever found themselves in a waiting room.
Welcome to The Paradox. I'm your host, Dr. Eric Larson. Thank you for joining me as we explore the U.S. medical system in a fun and informative format where you can learn about what physicians face through expert analysis. Today's expert is Dr. Amaryllis Sanchez Wohlever. She is the author of the new book, Recapturing Joy in Medicine, which she describes as a coaching manual for physicians to live well and lead effectively. The book does a great job of walking you through all the different problems that you may face in your professional or personal life, how it affects either sphere, and then ways of correcting that and reorienting and rebalancing your life. In today's interview, we'll talk about a lot of those topics, specific things that can be used to rebalance and refocus professional and personal career. And it's a great also that we'd go into the discussion of how she finds so much satisfaction in working with organized medicine. And that is not, of course, unionized medicine, but it's organized in the sense that used through medical societies. And how she works with state legislators and other elected officials to advance issues that are related to physician wellness and improved patient care. Dr. Wohlever's book, in addition to links that are referred to in the show, can be found at theparadox.com/052. And without further ado, a discussion on bringing joy back to medicine with Dr. Amaryllis Sanchez Wohlever. Enjoy. Well, welcome. I'm here today with a repeat guest, Mari Amaryllis Sanchez Wohlever. Dr. Wohlever is the author of the new book, Recapturing Joy in Medicine, a coaching manual for physicians to live well and lead effectively. Dr. Sanchez is a family physician in Florida. She's a public speaker, coach for physicians. She's all over the place, and she's involved also in organized medicine in Florida and nationally. And she's been spreading the joy of medicine for quite some time now. So, Dr. Wohlever, thank you so much for being here today.
Thank you so much for having me back. I think it was episode 15 where I was first with you.
Right. You're now the second repeat guest. So I don't know if there's a prize for getting more than two. But I've actually now passed episode 50, so it's actually kind of shocking.
Excellent.
I don't know what my initial goal was. I guess I didn't really have an initial goal except to have a couple people listen to my show. So it has been a learning experience for me talking to people like you and just people in medicine who are on different professions and just dealing with different things. And so the part that you deal with, I guess I would say, is sort of the human aspect and sort of the I guess the wellness part for physicians. And so let's just talk about your book that you just put out. So what would you say the general goal of your book was, and what drove you to write it?
Yeah, well, wonderful. I would say the general goal is to really help my colleagues to recapture that hope to make a difference in people's lives that drew them to medicine in the first place. And there are so many obstacles nowadays to providing that compassionate, excellent care that we are all trained to provide. And so having experienced that in my own life, I now, essentially that's what I do is I want to help my colleagues to recapture what brought them into medicine in the first place, to learn ways to, prevent burnout and recover from it and just do better. So that they can use their skills, their strengths, to help people, which is what I think we all, I interview, in the past I have interviewed students who want to go to medical school, and they still tell you they want to become a physician because they want to help people. So that's what I do.
Yeah, and I must mention this every episode, but I feel like the number one professional satisfier for physicians is the relationship we have with our patients and the ability to treat people, help them. I mean, that's what draws virtually everyone into medicine, I think. And how you help people is obviously different, but fundamentally that's why we're all in the business, as they say.
Exactly. So when I speak to physicians, I always say, we know that the most central part is the patient-physician relationship, and it continues to be shoved to the corner of a room. And so anything we can do to bring that relationship back to the center will bring greater joy. And in fact, the Physicians Foundation survey of American physicians in 2018 still shows that 78.7% of physicians say the most satisfying part of practice is the relationship with patients. So that remains our primary satisfier.
Right. Mm-hmm. And then you'd say that the focus for the physicians and to maintain the wellness and increase it and to maximize it is obviously to keep that as sort of your singular focus. Is that correct?
Yeah, I think the bottom line is that we cannot give what we don't have. And so I actually just got back from a wonderful conference that focused on physician wellness. And that's what we spent 4 days talking about is how we do better so that we can care for others better. It's like that analogy on a plane where you place the oxygen mask on your face first. I think we tend to be wonderful at caring for others, at being other-centered. But truly, we need to go back to, okay, if we don't do a better job taking care of ourselves, it's going to be pretty hard to continue in a sustainable way to take care of other people when we're, trying to overcome so many obstacles every single day. I mean, it's just exhausting simply to see patients now. And so if we're not caring for ourselves, advocating for our own needs, making sure that we have what we need and our teams have what they need, to care for people, it's just not going to work out. And so that's why we have an epidemic, not only of physician burnout, but unfortunately of physician suicide in this nation. So that's why I decided, I need to get this book out as soon as I can, because it's a hopeful, practical, interactive resource like I really haven't seen another. And some of the physicians who have already read it have said, I wish I had this when I started medical school, and have it to continue to refer to throughout my career. So that's my goal. My goal is that it gets in the hands of every medical student, resident, fellow, and physicians in practice as a resource that they can use alongside their practice.
Right. And I think the general format of the book has a quote that sort of focuses on one aspect of medicine that of practice, and then there's a brief description, I guess you'd say, for a couple pages, and then there's a practical sort of exercise that one could go through to figure out, how to incorporate the sort of the tip or the trick for facing whatever certain challenge that you're focusing on in that section. You mentioned if you can't take care of yourself, you really can't do a good job taking care of your patients.
Right.
And I think, one huge component of that too is if you're not taking care of yourself, it's going to be very challenging because we all have lives outside of medicine too when you go home. And if you're not, there are just as many pulls and stressors at home, if not more sometimes, than at work.
Yeah.
And so that I assume is also a big focus of your book as well.
Yeah. So, really, a lot of the foundation of the book is recognizing that before we became a physician, we were a human being. And although that sounds really obvious, I think our training does such a great job at teaching us to constantly focus on the patient and somebody else's needs but yourself. And in training, we learned that we, for example, if we're assisting a surgical procedure or one of these long surgeries like I had during vascular surgery rotations, you learn that your needs are second, third, fourth, right? And so you might need to go to the restroom for hours and hours, and you just sit there and wait. And so we get very good at not caring for ourselves. And so the problem is our training is so long that if we develop bad self-care habits during training, our training lasts at least 8 years, beyond college. And so sometimes longer. It's sometimes longer than a decade. So if you have more than a decade of bad habits forming, it's pretty hard to break them once you come out into practice. And many doctors never break them. And so eventually, it's gonna show up through illness or through other, mental, emotional aspects that really reflect the fact that you continue to neglect your soul and your own needs, whether they're physical, emotional, mental, relational, social. We are human beings before we are physicians. And to the extent that we care for our own needs, we will be able to care for others better. So I believe the transformation that we need to bring to healthcare really needs to reflect the transformation that takes place within us.
Yeah, and I would say from a personal standpoint, I'm really good at making it through a 5-hour surgery without having to go to the bathroom.
Right.
Which is probably not a good on my bladder, but
right.
But you do what you have to do sometimes, right?
Exactly.
How have you seen physicians realign their lives using? Because I know you've said you've been a coach for physicians before,
right?
And then when it comes to realignment, how do you know what you need to realign? How you need to realign. I mean, or if you say, "Oh, I need to realign," things are just not going well. How do you get to the point where you figure out what that even means?
Well, I think it's different for each physician for sure. And I still do coaching, and it's a wonderful and very rewarding process that for some coaches begins with work, but I actually choose to do it differently. And I begin with a person's bigger life, right? So I begin with your whole life from the get-go. And so that actually gets us to where we need to go quicker, I think. But one of the exercises you can do involves having a personal mission statement, looking at your values, what are your priorities in life? And then, so the way I put it is, who am I? Why am I here? Why am I even a physician? And how will I serve with the gifts and the uniqueness of who I am? And so those questions to me are foundational to recapturing joy in medicine and really in life, because they begin to align you with the unique person that you were created to be. And so usually I will start with something like that. And then the answers, again, will be different for each of us. And based on, our own values and, how we want to serve patients through medicine, but also using other gifts that we may have. In my case, when I stepped off the treadmill, is the way I call it, of my medical life, I really began to recognize strengths and gifts that I had that I was completely neglecting, one of which was writing. And when I began to write again, which I had completely almost stopped doing during med school and in residency, when I began to write again, I began to sort of process life in a different way. And I began to impact others, including my colleagues, in a different way. And it was a very freeing activity that I had completely neglected. And so for some doctors, they're neglecting an instrument they play or something where it really helps them to settle their mind or quiet their mind, settle their soul, things like that, that can be so helpful. And we just, we step on the treadmill when we arrive in medical school, and we just never get off unless we're intentional. And it can really make a difference when we do.
Right. I mean, you'll hear physicians all the time say that, what was it like when you were in medical school? What kind of books you read? They're like, well, it's all medical books. It wasn't until you get to residency or even finish residency that you read for fun again. It's almost like you don't have that opportunity because you have so little time.
Right.
Do you ever have people who write mission statements saying they want to be a healthcare leader in 5 years? No, I'm joking. I feel like that's every hospital's mission statement.
Yeah.
Which I think is kind of amusing because I never really know what that means, but I guess you can always achieve it.
Exactly. Well, you know what I would say about that though is that, I have seen some physicians who become healthcare leaders sort of as an escape strategy from their own burnout. And if you never go through the process of healing and all the lessons you can learn having been burned out or close to it, you've really missed out on something very important. So I think it's important for the people who, who are not thriving and recognize it, to walk through that process to get to the other side in a healthier way. And those lessons can help you with your team. They can really help you to not do those things that led you where you ended up. And so there's very important lessons, just like with any suffering or anything difficult we go through, that if we allow ourselves to learn those lessons, we will be better off on the other side.
Yeah, I see that all the time, and it's something I didn't recognize initially until I got to know some of these people when they were making these life changes. But I will see physicians who leave their profession and to go into administrative work, because I think there's a perception like it's the rat race portion of it is kind of better. It's less stressful, than living in the ER or in the OR or wherever it might be.
Right.
But I have, at least in talking to them or to their family members, they generally are not any happier. In fact, they're sometimes less happy because I think they feel like it's a less meaningful work.
Right.
It solved some of their problems, like maybe the call or the things they perceived as the real issues, but it didn't probably solve the other things, probably what you're speaking of, right? The sort of the soul or the soul issues, I guess.
Yeah. Yeah, I think your point is definitely true, and I've seen that happen, and I think so again, I mean, I think it's important to step back and consider, like, why am I a physician, and how do I want to serve people? And I think that's a question that we often don't ask ourselves, and if we're in jobs where we're just not happy or we're not finding meaning, it is so helpful to step back and speak to an outsider, and to really just kind of find small ways. I always, when I coach doctors, I say, find one thing that will make things fairly quickly, that's fairly easy to solve, and fairly quickly you will find some results from it, and then just kind of get on this journey to try to improve things slowly. But the physicians that I see doing best when they have been burned out is the ones who get proactive, the ones who stop sort of, complaining, which is very easy to fall into that, and that get proactive about doing something about it. I know for me, not only did that help in practice, but also to get active in medicine at the national level and at the state level, in advocacy, has been so empowering for me and gives me hope, because I have gotten to meet so many physicians that are so exceptional and are doing so many great things. And so that has been tremendously helpful to me.
Well, that's a good example. When it comes to the profession and burnout, I mean, I feel like one of the main ways people describe it is this helplessness. You're in this position where there's no way that you can fix anything you're dealing with, and there's no way out. So what would be an example of like a quick, easy fix? Because you mentioned that sort of it's sort of like taking on debt, where you have maybe 10 debts, you take off the smallest one. It maybe it doesn't have the biggest interest rate, but you pay off that $1,000. You're like, oh, okay, I'm making progress, and now you can sort of start tackling the bigger ones. So what would be an example of like an easy that you maybe one of your physicians you've worked with? What's like an easy thing that they did that kind of helped them along that road?
An easy fix is something like, if you're continually interrupted, say when patients call in or when email messages come in, and your MA or nurse, whoever your assistant is, continually interrupts you throughout the day, and say you're one of the doctors, maybe like me, who does a lot better if I can fully focus on my patients until I'm done, and then I like to deal with messages. So it can be very, very helpful to have a conversation with whoever your assistant is and say, hey, can we talk about messages at the very beginning of my morning, and when I'm done, maybe halfway through the morning, and at the very end of when I'm done seeing my shift. And so so you control how that's happening a little bit better, and that can be, or batching messages. Of course you can always be interrupted with emergencies and things that are more urgent, right. But not continually, so that you continually have to shift gears between emergencies, urgencies, and the trivial, the very, very trivial, and things that can wait. And so that can be very low-lying fruit, and a fairly quick fix, and there's a lot of things like that. And so again, for every doctor, it'll be a little different, but often we are so overwhelmed because there are so many things that are making us less efficient and driving us crazy when we see patients, that they just get overwhelmed, and that takes away their energy to act. And so again, if you just step back and just, okay, let's choose one thing and we'll work on that, and then go to the next one, that is very empowering, and there's hope. You don't feel so helpless, and that's important.
Yeah, because you've changed something, and you've brought yourself into control of at least one aspect of your day.
Yeah, and what we have lost is autonomy. So so to the extent that I can return some control and autonomy over clinical decision making, and also the efficiency of work, boy, it really makes a difference. And then when people feel hope, I mean, hope is healing in itself. And so that's what I try to do continually, is increase hope. And so that's why I wrote this book. It's very hopeful. It moves forward. It is informed by 25 years in medicine, and understanding how frustrating and just exhausting it is to see patients in some settings these days. But what I do is I talk about what is possible, what we can do, right? Because often, again, if we focus on the things we cannot control, that puts you in a place of helplessness. But if you focus on the things you do have control over, now you are proactively involved in making things better. And so, for us as doctors, we are natural leaders. We were leaders when we arrived in medical school. So that's part of our frustration is, we are leaders who can't lead because we're either disempowered in our organizations or we feel disempowered. And leaders who are disempowered disengage, or they burn out or they leave. That's what I've seen. And so I try to give, to empower my colleagues and make sure that they become equipped so they can provide excellent care. And those 3 E's are what I call the physician leaders triad. So we need to be equipped, we need to be empowered so that we can provide the excellent care we're trained to provide. And that is a happy doctor right there.
Yeah. This is kind of leads to the natural question where employed versus independent physician, right? I mean, if you are the boss at your clinic and you're running it, maybe you have some partners, but essentially everyone who's there works for you on some level. You probably have a lot more power in changing processes and things that might drive you bananas that you maybe didn't realize that with mission creep that suddenly, something's happening that you should change. But when physicians are in an employed setting, they may not have as much control over things. I mean, certainly you don't have control over your electronic health record oftentimes and sort of how it works. Do you find that it's harder for those physicians to find ways out, or are there plenty of opportunities for low-hanging fruit with their practices as well?
I mean, I think we all have opportunities to find some low-lying fruit, but definitely it has become a lot harder because now more than 70% of doctors are employed. And so, not independent. And so that's part of, why burnout is just skyrocketing, and continuing. The other thing that's happened is that there's a lot less hospitals that are actually run by physicians. In 1935, physicians were in charge of 35% of hospitals in the United States. And as of 2009, physicians only lead 3.6% of hospitals in our country.
Yeah.
And so that's a 90% decrease. And so sadly, those hospitals do not have better outcomes, and actually the costs have gone up rather than down. And so I believe we need more physicians running, health systems and hospitals and clinics in the country, and that's something that needs to go back.
Yeah, and that's always the struggle I have advocating for something like that. I see it. On some level, it's important to have physicians who know what it's like in the trenches. But on the other hand, I hate losing clinical people.
True.
Who would be into areas where they're, potentially not really taking care of anybody and really helping. I suppose it depends on how the system is structured. If you're a physician who leaves for the administration and you're in a sort of somewhat powerless middleman position where you really can't change anything except maybe a couple committees, then it's probably not as helpful as someone who might be the true leader at the top of the organization.
Totally.
I suppose that's...
Yeah, we're talking about true leadership, and there is a leadership void right now in medicine. And so, to the extent that we, and that's what I'm trying to do. I'm trying to get doctors to speak up again. I think now we have, as of 2009, physicians were outnumbered 10-1 by non-clinical administrators. And so what I always say to my colleagues is that for every physician who goes mute in their organization and stops speaking up, that is 10 non-clinical voices that are, speaking loud and clear. And so, so we really do need to speak up again. It's tough though, because some doctors, they're afraid of getting fired. They're afraid to be labeled, quote, disruptive. And, and it's justified in many places. So it's a very tricky time right now in healthcare.
Yeah, you suddenly are outnumbered 20-1 for every person who's silent, right? So in part of your book, you talk about multitasking and how it's, on some level, everybody at some point has to be multitasking. You have to have multiple things going on. So when does it become a problem, the multitasking, and what do you do to fix that?
Right. Well, to me, I think, again, we were human before we became physicians. And so whether it's multitasking or perfectionism or some of the personality traits that many physicians have and that have made us excel in medicine are very tough when you have them stay in your relationships, in your parenting with your spouses. Yeah. And so if that multitasking that helps you to do very well, say in an operating room. If you bring that into your day-to-day life in other areas, it might help you cooking. I wish I had the multitasking ability my daughter has when she cooks. So in some areas, it really helps you. But if you bring that into just sort of like your daily life, it is a great way to become sort of divided in your mind and to live a scattered life. And again, I do a lot of work, that has to do with the soul. And so, that multitasking is sort of the opposite of a mindful presence, right? Which is so important if you really want to attentively listen to someone. And so, multitasking can help you in some settings, but probably not if you're, have a patient in front of you who just lost a loved one or has had a major loss or something where they need you to be still and quiet and listen and expressing empathy. And so sort of if your mind lives in a multitasking world, it's very hard to transition sometimes. And so does that make sense? The same thing applies to like our perfectionism. It's great if we're, thinking about drug interactions or, prescribing or all the many things we do, or in the operating room, right? Or in your world of anesthesia. But our perfectionism does not help us in our interpersonal relationships with people, in our parenting. If we expect perfection from ourselves, that probably means we expect perfection from others. And so we're going to leave very disappointed because none of us is perfect. So,
yeah, well, you can speak for yourself. No, and I feel like one of the things that really leads to more multitasking and distractions and stuff is of social media and our phones and email and all. And I think there are even studies proving that the more that using this, especially at certain times, it just increases your anxiety level. Just because like, oh, do I have a couple emails I need to answer, or see what's, there's always something to sort of check on and look at, whether it's your Twitter feed or your Instagram or Facebook.
Yeah.
And I think
you
probably just have to be more mindful.
You're not present to the moment. Yeah.
Yeah. And I feel like it adds to levels of anxiety, like to try and go to sleep right after you look at your email. It's really kind of tough.
Exactly. Yeah. What is that doing? What is that doing to your mind? Really? I mean, it'd be, I've not seen specific studies. Like it'd be interesting to look at a PET scan of someone's brain, right? Right after, say, when they're looking at emails right as they go to bed. What does that do? It would be fascinating.
It's interesting. They actually do studies like I think the functional MRIs, but I don't know if I could look at my email and suddenly then fall asleep while I'm going to MRI scanner. I'm not quite sure how they managed to pull these things off, that anyone could actually ever fall asleep in an MRI scanner. Anyway, so
yeah.
You said something which is, I think, kind of amazing, or surprising, maybe is a better word. You said that working within organized medicine has given you tremendous hope and is something that you find very rewarding.
Yeah.
I have found most people who work in organized medicine, and for those listening who are not familiar with what the term is, it does not mean people who are unionizing in physicians, things like that. Organized medicine generally refers to people working within medical societies or large medical organizations, like either physician specialty organizations who are advocating for regulatory legislative changes or some changes to medicine, the practice or something like that. So what is it about organized medicine that gets you excited? Because again, most people, it's not drudgery. They maybe enjoy the sort of the political aspect of it, or they see the importance of it, but I don't find people like finding it generally like, they get super excited or pumped about it.
Probably the best part of it for me has been the people that I've been able to work with. And I mean, I've just met some of the most exceptional doctors through, the different things I've gotten to do. Like I served on the Florida Academy of Family Physicians on the board of directors. I just finished a 4-year term in December. And I just met with, I just worked with some of the best leaders. And, no, we did not bring all the changes that we were hoping for. And I mean, it's slow and it can be frustrating, to drive change, right? But we did work on some things. And so, when I joined the board, I said, we need to have like a physician wellness committee or something, right? And so I wrote like a 3-page document. And, a few years later, I am chair of the Physician Wellness Subcommittee, which is probably becoming its own committee within the next, few months. And so it's exciting when you see it. I mean, it's slower than you would want, but change does happen. And also meeting legislators. I mean, I never would have thought that I would be doing things like going to the Capitol here in Florida and in DC and meeting with legislators and their LAs, which are wonderful, the legislative assistants. And so I've done that, and I actually have a meeting tomorrow with our local senator because now they're in the interim. The legislative session has ended, and so, in the interim, I get to go to his district office and, talk about issues that are important to me and what I see happening in my town and in our nation. And it's empowering just to have a voice, And so, those are some of the things that I have found really exciting.
How do you find your response from the local politicians, both the state reps and the senators? My experience in Michigan has been, I think, they're always deferential. They're always polite to you when they're talking to you. But, in talking to our lobbyists within the State Medical Society or others who work on legislation, the view, at least in Michigan here, is fairly negative towards physicians. And do you find that the same in Florida? Are you able to find legislators who are able to partner with and get legislation through?
Yeah, so I haven't been involved with like a bill that I helped, push or anything like that. But I have found that legislators with whom I have been able to speak one-on-one to actually be very open to that and very happy to hear from physicians and very welcoming. So I don't know if that's a Florida thing or if I've just been blessed with the people that I've been able to work with. But I have found the process actually very, very good. Being able to go and be there during a session of the House of Representatives or the Senate, right here in Florida and seeing the things that are being discussed. I don't know, I find it inspiring. And it gives me hope, even if change is slow, and we have some legislators that I am completely in disagreement with them,
Sure.
But I shake their hands, and I'm happy that at least they're engaged and wanting to do something, right? And so that's how I try to think about it. And I don't care if they're Republican or Democrat or what. I just care about patients. My biggest thing is really patient safety. I have a lot of concerns over some of the ways healthcare is changing, and it's not good for patients. And so when I'm not around, I want my children to have excellent healthcare available, like I have been able to access my whole life. And so that's why I work, and I don't let the frustration kind of stop me, whether it comes from the legislators or from my own academy. Sometimes, certainly at the national level,
Right.
There's a lot of issues that sometimes tie the hands of some, or there's just competing priorities, right? But again, I try to focus on what I can do and what is possible, and that helps me keep going and not get hopeless.
So and I find this interesting because when you're you're not fighting for specific legislation. So when you go to visit these politicians, do you have any sort of agenda, or do you think I just want to talk about what life's like for me, what the profession's like, my concerns, and I'm not pushing any sort of bill, I'm not pushing any sort of regulatory change. I just want them to know what's going on and just meet them. Is that pretty much your approach?
I would say both. I think it's really great if you meet them. If you don't have an agenda at all, simply to be a resource. So it's great when our legislators have questions that have to do with healthcare, if they come to the experts, right? And physicians are the most highly trained member of the healthcare team in terms of medicine, right? And so I think it's very important that every legislator have a physician on their cell phone that they can call, more than one. With questions related to medicine. And so that's very important. I also have some things that I care a lot about. For example, we need increased funding for graduate medical education. There's a quote
Sure.
physician shortage, which is really because the residency training spots have been frozen for decades. And so that needs to be reversed. And so there's a bill right now in the Senate at the national level, which is trying to solve that issue. So, there's some things individually that I will fight for. But I think it's important just to, be a resource.
And so you're basically just introducing yourself oftentimes to these legislators.
Yeah, I'll do that.
Okay.
Or what I did this week is I, called and said, hey, we talked a little bit when I was at the Capitol in March about some issues. Let's continue that conversation. And so that's what we're doing now in district. It's pretty cool.
Well, that's interesting. That's probably a smarter approach too. And I don't know if that's maybe that's just my personality that I tend to have agenda focused conversations. I don't know if that's a male thing too, where
I think
I'm calling
both
just for
are
purpose.
important. I mean, I do too, and we're gonna bring some materials with some different issues that we want to discuss. But I think it's about relationships, and what happens with as I mean, they continually rotate, and so every 2 years, you get new people, and so you got to re-educate.
We have the same thing.
You have to re-educate them, and so, but to the extent that you are nurturing some relationships, that will give you, their ear. They will want to hear from you. So
sure. And do you get involved in campaigns as well, or do you just kind of meet them after the dust is settled?
A little bit. I've done that a little bit. Yeah.
Okay.
Yeah.
Sure.
Maybe one day if I run, I'll be really involved.
Yeah, you can talk to me about that. I can tell you what my experience was someday.
Oh, I love that.
Twice.
Yeah.
You may think twice. We just refer to it as the near miss in my family.
Excellent.
I almost won. Well, as always, I appreciate the conversation. And again, the book is Recapturing Joy in Medicine by Dr. Amaryllis Sanchez Wohlever. I love saying that name. But Mari, thank you so much for being on. Where's a good place for people to find out more what you're doing, to follow your writing and those sorts of things? Sure.
So I have a website. It's faithfulmd for medicaldoctor.com. Also, I find that if people just Google my name, they usually get to my website. But yeah, it's faithfulmd.com. And that has information about my coaching, about my speaking, and also about my books. I have 4 now, and this is my latest. And I'm very excited to get it in the hands where it needs to get to make a real difference. So I thank you.
Twitter?
I do have a Twitter, and on Twitter I am at FaithfulMDCoach.
And let's see, Instagram, any of those sorts of things? Or
I don't have Instagram.
Yeah, I don't know. You can only be on a couple social media sites at once and be effective, I think, or maybe like 1 or 2.
Exactly.
Yeah. I'm actually surprised that people Google Amaryllis Sanchez Wohlever, they get you. I mean, they don't get some other one who's.
Right. I'm sure there's many with that exact name.
Yeah. Right. I had Dr. Herkelroth on before. It's probably fair to say that you're probably the only Dr. Deborah Herkelroth in the country. It's like, oh yeah, I hadn't thought about that.
Exactly. So. Soon there's going to be a Facebook page which will be called Recapturing Joy in Medicine. So that's coming. And right now my Facebook page is the name is my business name, which is Impact Writing and Coaching. So I do have some doctors who follow me there.
Okay.
So I have some things coming.
Well, thank you so much for your time. I appreciate it, and it's always a delight.
Thank you so much for having me, Dr. Larson.
Thanks for listening to The Paradox. If you like what the doc is doing, please subscribe and leave a review on iTunes or Stitcher. And share the show with your friends. Become a supporting listener to get access to special bonuses at patreon.com/theparadox. Show notes can be found at theparadox.com.